Good morning, everyone. I'm Dr. Mandal, consultant hematologist in NHS, and today I'm going to talk to you about lymphomas. So, what are lymphomas? It is a condition that we get a lot of referrals with. It is one of our highest reasons for referral into a hematology clinic. So, lymphomas are cancers of a particular type of white cells in the blood, which are lymphocytes. Now, the main function of the lymphocytes are to fight infections, and they also form part of our immunity. So, the lymphocytes, they are generated in the bone marrow, and then during the course of their lifetime they get out into the bloodstream, and they also go into the lymph nodes to perform various functions. And so consequently, a lymphoma or a cancer of these lymphocytes can arise from any stage of the development of the lymphocyte, and depending on which stage it is, a lymphoma can involve just the lymph nodes or the lymph nodes and the bone marrow. Liver and spleen are also commonly involved because they are part of what we call the lymphoreticular system, and indeed it can also go out into other organs and tissues. Because the nature of blood and bone marrow is everywhere to start with, it's very common to find lymphomas everywhere to start with. And that is one of the key differences we find we have to explain to patients, is that it's not a solid organ cancer where it occurs in one area of the body and then spreads out to other regions. Although lymphomas can also follow that pattern, but it is not unusual to find it everywhere. Now, this is going to be a very brief overview because the topic is very, very large. By and large, we have got two types of lymphocytes, B and T, and a lymphoma or a cancer of the lymphocyte can involve either of these cells. As I mentioned before, depending on the life cycle, it can occur in the lymph nodes or in the blood and bone marrow, or in both the places, and outside the lymphoreticular system as well. Now, they are further subdivided into Hodgkin's and non-Hodgkin's lymphoma. The Hodgkin's lymphoma are an aggressive variety of lymphoma, and we have a lot of young individuals get affected by it. But the good news is that it is aggressive, but it has got a very high chance of cure. The non-Hodgkin's lymphoma are further divided into aggressive, which follow a very fast-paced course of action. They need treatment with chemotherapy, and often they also remain curable. And this group of lymphomas often achieves the highest rate of cures across the board of hematological cancers. The other subgroup is an indolent lymphoma, where it follows a very chronic or an indolent course, almost like a chronic disorder that people live with. People can live with these cancers for a long time without these cancers affecting them. And indeed, we don't treat these cancers unless it is causing you certain specific problems, because it's possible to live a relatively healthy and normal life despite having the diagnosis of a cancer. And this is so different compared to the normal adage that comes with cancers, that, oh my god, this is life-threatening and I need chemotherapy instantly. So it's quite variable, the lymphomas. Now, what are the symptoms of lymphoma? Sometimes it's an incidental finding and there are no symptoms at all. People present to their GPs with an innocent lump somewhere, and the biopsy of that proves lymphoma. Other individuals will have issues with their blood count, and they may present with certain symptoms like weight loss, profuse drenching, night sweats, recurrent infections, tiredness, lethargy, and so on. And sometimes the symptoms will depend on where exactly the lymphoma is. Now, we are treating lymphomas across the range of the board, and it goes on from various lines of chemotherapy to even transplantation, CAR T, bite cells, and many other lines. So if you feel that you need any help or have received a significant diagnosis, then please feel free to contact us. Thank you.